Patient comes into the emergency department for abdominal pain associated with watery diarrhea. He is depressed and has difficulty with his memory. He has a long history of alcohol use disorder. A pigmented scaly skin rash is present in the molar distribution of the face, neck, and back of the hands. The rash has been present for the last 2 months and worsens on exposure to sunlight. It is determined that his symptoms are due to lack of a specific nutrient. Which of the following enzymes is most likely affected by this deficiency? Now, this patient presenting with a watery diarrhea, difficulty with memory, as well as a photosensitive dermatitis likely has pellagra. Now remember that pellagra has the three Ds. The first D is going to be diarrhea. The second D is dementia, so he has difficulty with his memory. And the third D is going to be dermatitis. He has a rash that gets worse with sunlight, and a photosensitive dermatitis is going to be a characteristic feature of pellagra. Now, pellagra is going to be due to a vitamin B3 deficiency. Vitamin B3 is also known as niacin, and usually patients with alcohol use disorder as well as patients at risk for nutrition deficiencies are going to be developing pellagra most commonly. And here in this image, we're going to see the characteristic rash of pellagra in this individual. Now, niacin is really important um, for many reactions in our body because it is going to act as a precursor for NAD and NADP. So here in the citric acid cycle, we have many enzymes that needs NAD as a cofactor in order to go on with the reaction. So one of the choices that we had, if we go back to our answer choices, is going to be isocitrate dehydrogenase, which is going to be the correct answer. As you can see over here, isocitrate will not be able to be converted into alpha ketoglutarate without the cofactor NAD+. And because niacin is a precursor for NAD+, if we have a vitamin B3 deficiency, then this reaction won't go on. So as a result, isocitrate dehydrogenase is going to be the enzyme that is going to be impacted by a niacin deficiency or a vitamin B3 deficiency.